As the sun rises over the shores of Lake Nyasa in Tanzania, an unusual shipment arrives by boat. Organizers of the country's Tahara program are bringing supplies for an intervention to help reduce the high HIV rates in the area. What is it? Voluntary medical male circumcision.
Kwamba point nasema ni kwamba imethibitika kitaala kwamba kwa wanaume kutahiri ni moja ya kinga muhimu.
Speaking in support of Tahara, the local word for circumcision, Tanzania's president Kikwete references studies that show that voluntary medical male circumcision can decrease a heterosexual male's risk of acquiring HIV by up to 60%. Following WHO and UNAIDS recommendations, 14 countries in Eastern and Southern Africa are scaling up their programs, potentially averting millions of new HIV infections. Tanzania's Tahara program hopes to reach individuals like Yohana.
Mimi kwa jina naitwa Yohana Mwinuka. Hapa nipo na familia yangu. Nina watoto wawili wa kiume na mke wangu. Mimi hapa nina miaka 32 na mke wangu ana miaka 30. Mtoto wa kwanza ana miaka 10 ambaye ni Alpha. Wa pili ana miaka 8 ambaye ni Rutu. Na ufahamu ugonjwa wa ukimwi na ufahamu kwa sababu umeshawahi nitokea hata mimi mwenyewe kwenye familia yangu. Niliposikia hilo kwamba nikajua kwamba wanasema kwamba kuna uwezekano wa kupunguza maambukizi, ndipo nilipochukua hatua hiyo kwenda kufanywa tohara.
Yohana and his family living in Njombe, which in 2012 split from Iringa and has been highly impacted by the HIV epidemic. When the country's male circumcision strategy began in 2010, Iringa had the highest HIV prevalence in the country at 15.7% compared to the national average of 5.7%. It also had one of the lowest male circumcision rates at 29% compared to 67%. The Ministry of Health, with support from PEPFAR through USAID, launched the Voluntary Medical Male Circumcision Program in Iringa and began working with community leaders and the local media to attract clients. It wasn't an easy location to start this new initiative.
Changamoto kwa kusema kweli, kama unavyoona huu ni ukanda wa ziwa. Kwa hiyo usafiri ni wa majini. Unaweza kuwa kuna siku unataka kuja lakini ukashindwa kutokana kwamba dereva wa boti anaweza kukwambia ziwa chafu.
Although there were challenges in bringing Tahara to this remote area of Tanzania, the accessibility and quality of the services attracted Yohana and his wife Maria.
Niliposikia tu ndo pale tukawa na mama tukaanza kujadiliana kwamba bwana uende, ndipo mama akanishauri tukaenda.
Swala tohara tulisikia kwenye redio wakiongelea mambo ya tohara. Kwa hiyo mimi nikachukua uamuzi, nikamwambia mume wangu, nasikia habari ya nani ya tohara? Akaniambia ndio. Nikamwambia basi chukua uamuzi tuende kwenye zahanati ya Milo. Naye akaamua kaenda. Kufika kule akafanywa tohara na mtoto wangu akaenda.
Ninawashauri watoto wenzangu waende wakafanywe tohara ambao bado hawajafanyiwa.
At age 10, Alpha reflects a growing group of clients who are accessing services. Although the Tahara program serves clients in different age groups in Iringa and in Njombe, it is the adolescents, aged 10 to 19, and youth, aged 20 to 24, who are leading the way. They have decided they want to do it for HIV prevention reasons, for hygiene reasons, and they want to do it because it is considered modern. They know that eventually they may mix with people from circumcising regions and don't want to be the only uncircumcised boy. They know that women are now expecting their partners to be circumcised. But most importantly, they want to be part of an AIDS-free generation.
We are well prepared for the people, and I'm quite sure there will be a lot of people because today actually it's Sunday. Everybody will pass through churches, we'll go through political leaders and different village leaders. Today is a weekend, so most of the people were not busy. So I'm quite sure that we'll be having a lot of clients tomorrow, and I'm sure that we will reach the target.
Despite the enthusiasm for this HIV prevention intervention, clients are informed that it is not a magic bullet. Like more than 90% of other clients, Johanna and Alpha consented for HIV testing before the surgery. They were also educated on other methods and informed that voluntary medical male circumcision only provides partial protection from HIV infection.
So as you can see, the surgical removal of the foreskin is just one component of what we actually need to call a combination approach of intervention.
Baada ya hapa kuna sehemu ambayo katika muda ule wa dakika 30 anapokaa hapa anapewa maelezo ambayo yameandikwa hapa. Hapa tunaona kitu kimeandikwa hapa, post operative discharge instructions. Male circumcision protective effect not 100%.
Iringa and Njombe are on track to circumcise 341,000 clients by 2017. If the program manages to reach its goals, more than 20,000 HIV infections may be averted and $60 million in treatment costs may be saved between 2013 and 2050. Efforts to scale up services are not just occurring in Iringa and in Njombe, but throughout Tanzania. For the country's Tahara program to be most successful, an estimated 2.1 million clients will need to be circumcised over the next 5 years. In order to meet this goal, Tanzania reorganized its health workforce more efficiently in order to serve more clients more quickly. Nurses have played a key role in order to serve as voluntary medical male circumcision, or VMMC, providers.
In Tanzania, since independence, we recognized the shortage of trained medical personnel. The government of Tanzania decided to do a kind of task shifting, training of sub-cadre in all medical fields. So the title of whether being a clinician or a nurse in these services, it ends there.
Tanzania has demonstrated its commitment to assisting in driving down the incidence of HIV/AIDS, specifically as it affects voluntary medical male circumcision. They have decided that this is a way of reducing AIDS even further.
Despite the numerous obstacles that exist in scaling up voluntary medical male circumcision, such as cultural norms, difficult terrain, and fear of the unknown, the Tahara program in Tanzania has shown that with strong leadership and commitment from the national government, the support of donors and implementers, and with the goodwill of the people, It is possible to scale up VMMC services and avert millions of new HIV infections in sub-Saharan Africa. Lives can be saved. A new generation can be AIDS-free. And families like Johanna's are leading the way.
Swala hili la tohara kwa wanaume bwana linaweza likaleta mabadiliko makubwa tu. Tena sio kidogo.
And if it can be done in Tanzania, it can be done elsewhere too.
Sikaya taratibu inanyesha ni bala umegeuka hitaji.
Mwili wake utang'aa madini kama ngozi ya Papa King, na mke wake tamthamini hata kama kwao ni maskini. Mfano wa msimamo alionao wa kijahidina, na ametaka awe mgumu kama rapa Karapina. Akupe kima, busara na heshima pia. Baba taifa yupo poni, silie mama Maria. Mwanangu ni jendo toni na ndio mambo bone ambia. Mwanangu ni jendo toni na ndio mambo bone ambia. Akienda kwa ndugu zake atojisikia yupo nyumbani, sababu babake shafukuzwa kosa alisahau kusuza sahani. Katengwa na ndugu na kusaidiwa na mtu baki. Upendo wa Mungu mwanadamu alenda moyo.